all of these distractions and disruptions from number 45 in regards to humans' needs, human right to health care is ridiculous. The redundancy of it to continuously go backtrack something, to undo something that is not already ironclad. I mean, it's not really good at all. There are so many issues with this whole current health insurance epidemic, okay, because it is so commercialized. It is no longer about patients' care, patients' rights, or any of that. It has become something that capitalists have figured they're going to monopolize off of. They're going to strategically figure out a way where they can all place themselves in places of employment and receive federal funding for people's healthcare needs, when in fact they're not doing anything to ensure people is getting preventative care, or people is getting the care that they need, diagnosis that they need, and that we are saving lives in America with all of the technological and medical advances. It's absurd. Currently in New York State, I don't know about other states. I don't know how it works. I haven't investigated that state. But for New York State, we have an issue. Because while they're going back and forth playing this game with the Republicans and the president about this health care, just because he wants to name it after himself, dumpster. It's so disrespectful to citizens who have fought for freedom. It's very disrespectful for citizens that have fought for equalities and rights. It is so disrespectful for a person like him to even be allowed to have gotten this far. Such a questionable person that we was going to allow to have some input and say over the healthcare needs of people when he is not even qualified. He is not even presidential. And so we have a whole bunch of people who already have medical needs that are not getting the medical attention that they need. We have a whole bunch of medical providers, clinics, hospitals, doctor's office, dentists that are already discriminatory toward Medicaid recipients, possibly some Medicare recipients. We know that Medicare is not giving to colored people under the age of 65. Now, I know a few people over the age that are colored that are benefiting from the program. But there is some misinformation and some misleading going on out there. Because colored disabled citizens are not receiving nor utilizing Medicare. Not seniors. Maybe. But not anyone else. Not. And so right now, currently, we have two things going on. One thing is that in New York State, they're telling people now that are defined, documented, that's what that means, by Social Security law to be disabled are entitled to go to their local government Department of Social Services to apply for health insurance. Or the state puts them on the Medicaid program. They're not a senior. And so for everyone else that are not deemed, follow what I'm saying, please, deemed, documented by the federal government to be disabled, which means that they wrote it down, they shared this information, they determined it amongst themselves, which they are not even medical professionals themselves. These are unqualified individuals that you don't have a regular interaction with, they don't know anything about you, that are making a determination about whether or not you actually have a disability based off of what another one of their colleagues believe. That's not sufficient. How do you come up with a diagnosis for treating a person that way? That's fraud. And so, does that mean that a person who is disabled, that has never been deemed disabled by federal law, is not entitled to get the healthcare services that they need if in fact they are disabled? they are not getting the services that they need in New York State right now, because New York State has a very complicated, systematic approach going on here for these people, these public officials, and these people answering the phone with New York State Health Marketplace Exchange, whatever you want to name it. These people that's answering the phone are not medical professionals. They don't even know how to deal with the disabled persons that are calling. They do not know how to accommodate people. There's something called a public accommodation by law. But for some reason, some people culturally don't want others to utilize the law in a way where it is suitable or beneficial to them. They just want to utilize the law where it's suitable to fit their needs. That's discriminatory. It is an explicit indifference. It is beyond discretion, because you are utilizing your discretion in such a way that you're acting outside of your official capacity, and you're no longer doing your job. You're using your personal perceptions to hinder your ability to do your job. Thereby, you are violating another human being's rights. Because see, federal rights supersede any local, municipal, or state laws, policies, or deregulations that we currently have going on. So these laws currently in New York State are in fact depriving millions of citizens. Okay? Follow me. Now, while they're depriving you of a human need, a human service, something that you need to be healthy to live, every day that you're not feeling well or you're not getting the treatment that you need is another day that that situation becomes exacerbated, agitated, overwhelmed, worsened, and thereby it becomes more costly. And so your care will go up. At your demise, they're still capitalizing and monopolizing. So many corporations and business structures, not your family, not you. You don't get better. But these people are going to continue to make a living, eat, luxury off of your hardships and your failing health. It is a strategic development to position people, and it is an enslavement to subject people to cruel and inhumane punishment. It is punishment. It is terrorizing to keep a person from mental health care services or pain management when they are physically in need of it. But we have a medical system right now that's doing that. And so it's become so much more concerned with protecting doctors and nurses from agitated patients that they forgot what they're actually there for. You're not there for your protections. You're there to be protecting the patient. You're there to be ensuring that their confidentiality is respected, that they can get the care that you can give them, the highest quality you can give them, regardless of what they can afford. Because all treatment should be the same regardless of who's paying or how it's being paid. It's not, you shouldn't be giving, okay, well, because this person has this insurance, we're not going to give them this type of care. We're not going to tell them certain things. We're not going to release their healthcare information to the other providers because they don't have good health care. So they're not entitled to quality health care, which makes no sense. Because it's still costly for the citizen in the long run. And still, the system is still going to strategically want to recover for any expenses, regardless if a person is sick or ailing or crippling or dying. A landlord will put him out. A light company will put him in jail. No one is accommodating the needs of humans right now. People are sick. And one thing I know and I believe is that there's no need for government but for healthcare and education and climate change. Some cultures have that shit misconstrued. They believe that it is about law and order because they want to manipulate and control everything to their benefit. We have to stand up, and this must stop. We don't need that old Congress that is doing the same old crap. We need a new attitude, a new systematic approach, a new systematic behavior so that citizens' needs are being adhered to. No, not 5 years down the line, not 10 years, decade down the line, not through a new presidency. No. When people are working in a government and everyone is working every day in social services and in human services, people are being regulated. Oh, people are going to be working. Cases, it shouldn't take a person in an emergency situation to get any assistance from their government 28 days later, 45 days later, 60, 90 days later after they applied in person or even online, because that's what you're encouraging people to do. The system needs to function cohesively so that you can adhere to realistic needs. People who have money, you have the fortunates to waste money and to do things and to think so ignorantly and live in your cloud of arrogance. But for those who are different, in a different circumstance, because pretty much you have placed them there and can find them there systematically, whether you want to take responsibility for it or not. When you debilitate people, that is a sickness. When you are sick, it is almost impossible to function at your highest capacity, thereby makes it almost impossible for you to work for an employer. People need to really start to consider what it is that they are wanting from their government and what they should be doing to get it. Healthcare isn't something that people should be debating. Another thing I know that doesn't make sense to me ever is why is it that this government is always trying to come after and undo work, hours and years of work that it took people to do? Why are we paying people to come and undo work? You must be paid to come and contribute, be innovative, be creative, have substance, be substantive. Listen, people don't need redundance. They have that in their personal life. People don't want to deal with idiotic, derelict leaders. Where are you leading us with that type of a mindset? We're trying to get out of that because you've already had us there long enough. The government must be responsible. All the money that the government spends on spying, war, unnecessary expenses on human service programs that are not working, research programs that are not curing anyone. We need to start putting the money that the people are paying into the government back into the communities for the people, the citizens. We cannot invest in corporations. They must make their own money to pay their own employees, to meet their overhead, and to strive. Because they forget how to be gracious and appreciative of the consumer base. You can't use the government to grant you access to a whole bunch of customers. You can't do that. I'm not giving that as a business owner or an author. The government cannot do that for certain corporations. It is an explicit indifference. It is discriminatory in the United States of America. And an individual who has sacrificed for a country understands that. Perhaps one who has not ever, would not, never. How could they? How could you expect one to? But how could a nation of Americans have false expectations of an entertainer, of a bankrupt businessman who hasn't even taken the time, honestly, to raise his own children? And he has many children with different baby mothers. But they're healthy. And he has conned enough people to have enough money, millions of dollars from his own father. He should have it. He has the United States Treasury Department right now. His children's health is not at risk, and so he does not really see the importance, the passion behind an American that understands what it means when you're depriving citizens and their children of health care because you don't like that citizen, because you don't want to help that citizen, because you're choosing to make that citizen wait. Whatever the case is, the justification, the excuse for the injustice of the injuries you're serving citizens, you should be compensating them for such a disservice. Healthcare is so important. It is so important that when people don't feel well, that they go into a doctor's office or a clinic, that they can trust these people with their bodies, not because they want their body parts, but that they can trust these people with their healthfulness. Not for them to use the medical profile that they have to figure out a strategic way to make the person sick, to debilitate the person. It's terroristic behavior, but it isn't nothing new. And we all know that. This has to stop. McConnell, go sit down or retire, sir. This is a new world. We need new views, new perceptions, new attitude, innovativeness. We need such a competitive country. After the embarrassment that you all have served your party, your culture, and your nation. Healthcare is essential. It is not a luxury, it is a necessity. And the Medicaid program worked very well prior to this whole Obamacare thing. It worked so much better. It needed improvement. We didn't improve it by putting all people's health care into the marketplace for people to bid and compete and to share. What are you people? What are you people doing? We need freedom from this systematic approach to murder citizens, because that's what it is. And it's already been happening to many of us. And so some of us can speak with a real story. And stories for some of us, such an unfortunate. These American horror stories from our governments